Starting in the name of Allah, who is most beneficent and the most merciful. This is Eiman, student of BS MLT, having 8th semester, and the topic I am going to present is on mucormycosis, also known as black fungus. Outlines. The outlines of this presentation includes introduction, etiology, epidemiology, major routes of transmission, pathogenesis, COVID-19 and mucormycosis, risk factors, types of infectious sites, signs and symptoms, diagnosis, prevention, and treatment. Mucormycosis. First of all, what is mucormycosis? Mucormycosis, previously known as zygomycosis because it is caused by a fungal agent of phylum Zygomycota. It is a serious but rare fungal infection. By serious, we mean that it is a deadly disease as its mortality rate is above 54% and is caused by a group of molds called mucormycetes, which is a class of fungi that includes several species of mucorales that cause infection in humans with weakened immune system. For example, Rhizophilus, Mucor, and Epsidia. These molds live throughout the environment. Mucormycosis mainly affect the people who have health problems or take medicines that lower the body abilities to fight germs and sickness. Here comes the etiology. Mucormycetes are present throughout the environment, particularly in the soils and in association with decaying organic matter such as zeep, compost, piles, and animal dung. As we all know that bacteria and fungi are the decomposer in our environment. They are more common in soil than in air, and in summer and fall than in winter or spring. Epidemiology. The incidence of mucormycosis is difficult to estimate since it is not a reportable disease and the risk varies widely in different populations. A review of 929 cases of mucormycosis that were reported between 1940 and 2003 noted that diabetes mellitus was the most common risk factor and found in 36% of the cases, followed by hematological malignancy, that is 17%, solid organ or hematopoietic cell transplantation, that was 12%. Major routes of transmission. There are three major routes of transmission for these fungal spores. The first one is inhalation. Through nasal cavity, inhalation of these spores will occur. The second was an ingestion, in which the ingestion of contaminated foods with these spores through oral cavity will occur. The third one is traumatic inoculation, that is the direct contact of skins with these spores by having cut, wounds, or injury. Here comes the pathogenesis. There are three modes of infection as we discussed earlier. The first one is inhalation. Through nasal mucosa, the spores will go to these following parts like either brain, orbit, paranasal cyanosis, palate, or lungs. While through ingestion, the spores will target either stomach or intestine, but in rare cases, mostly it infects the stomach. The third one, while in direct contact with spores, will infect the cutaneous layer of the skin. After reaching the target site, what will happen? The phagocytosis will occur by macrophages, while oxidative burst will occur by neutrophil to kill this type of fungus. If the person is immunocompromised, the risk factor will occur. What will happen? The spores will germinate into the hyphal form, means from vegetative form into infectious form. And inflammation will occur over that region. By clinical manifestation, we means that a sign and symptoms will appear at this stage. Okay. So the most important thing is that those fungus invade the blood vessels. We call it as angioinvasion, due to which thrombosis will occur. That is the blood clot formation in the blood vessels. So due to thrombosis, what will happen? Ischemia will occur. That is low oxygen supply to the tissue. So as a result, necrosis will occur, means the tissue will die due to lack of oxygen and blood supply. So what will happen? Black crust will form over that region. That's why we call the mucormycosis as a black fungal infection. COVID-19 and mucormycosis. A COVID-19 infected patient may be more susceptible to mucormycosis because of a dysregulated immune system and may receive immunosuppressant drug that prevent the phagocytic cells in the body from attacking the fungus at an optimum level. COVID-19 also increases iron in the circulation and the fungus uses this iron to grow. COVID-19 infected individuals are more often given oxygen therapy. Contamination in these devices can serve as a point of mucormycosis as an infection. Okay, in this given picture, you can see that the COVID-19 positive patient treated with steroids, immunosuppressant drug, and antibiotics, as well as you can also see that the oxygen therapy given to the patient of COVID-19, and those equipments can be contaminated with this type of fungus. So the COVID-19 patient has an increased level of iron in circulation and have dysregulated immune system, so it can't able to fight this type of fungal infection. So Those all factors can be the leading cause of mucormycosis in COVID-19 patient. Here comes the risk factor, which includes uncontrolled diabetes and diabetic ketoacidosis, corticosteroids, solid organ or bone marrow transplantation, hematological malignancies, COVID-19 diabetes, and trauma and burns. Because in these following conditions, patients are often given steroids like in diabetic mellitus to reduce swelling and inflammation, but it also causes a rise in blood sugar level. The fungus will take advantages of this sugar as a growing factor. In hematological malignancy and other several types of transplant, the steroids are given to suppress the immune system. So as a result, those patients are more likely to expose to this type of infection. Let's discuss the types of infectious site. The first one is rhinocerebral, which means that it would include the nose, paranasal cyanosis, and brain area, while the second one is rhinoorbital cerebral, means that it would include nose, paranasal cyanosis, eye, and brain region, while pulmonary means it would include the lungs, and the gastrointestinal mean it would include the stomach and intestines, and the other one is cutaneous, means it would involve the skin area, and by disseminated we means that through blood the fungus will enter to different organs of the body. It could be heart, liver, kidney, etc. The first picture showing the cutaneous infection caused by mucormycosis. The second picture shows the rhino-orbitocerebral infection. As you can see, the nose, eye, and brain area is infected by this fungus. This third one picture showing the infected stomach. And in the last one picture, that is the CT scan of chest revealing an extensive destruction of left upper lung due to pulmonary mucormycosis. Here we are going to discuss the infectious site and the related sinus symptoms. If the person have nose, paranasal cyanosis, and palate area infected, so their sinus symptoms will be nasal congestion, that is nasal passage will become swollen and inflamed and will have nasal blockage, black crust, paranasal pain, swelling, and paresthesia. By paresthesia we mean that it is the strict prickling and tingling sensation on skin, or you can say pins and needle-like sensation. If the infected area is brain, the person will experience a headache, vomiting, and seizures. If the infected area is orbit, what will be the sinus symptom? Diplopia means double vision. Person will see two images of single object. Ptosis will happen, means upper eyelid drop or eye. Periorbital cellulitis means infection of eyelid or the skin around the eye. Abrupt vision loss means sudden vision loss will occur. If the infected area is lungs, what will happen? Chest pain. And hypoptasis means blood will come in vomiting. And dyspnea, the person will experience a shortness of breath. If the infected area is stomach and intestine, then there will be ulcer, that is open sores will be formed on the lining of the stomach, small intestine, and other digestive system parts, and hemorrhage will occur, means loss of blood from the infected area. If it includes skin, so what will experience a person, that there will be formation of papules, that is the raised bump on skin that is usually pinkish and reddish in color, and pustules, raised bump on skin that contain the hairy pus, and black crust will be formed. The most important thing, here comes the diagnosis of this infection. For diagnosing this type of fungal infection, first we do is the sample collection, in which we collect the sample like tissue biopsy, which is the best sample, or deep nasal swab or nasal secretion. You should note that do not homogenize or grind the sample, because hyphae are very delicate and got damaged, so you will not see any growth on the culture. The second thing we do is sample microscopy, in which we use QH mount. For histopathological examination, we use the following stain like PS stain, that is periodic acid shift, and GMS stain, that is Comorius methyl amine silver stain. The other is fluorescence staining for sample microscopy, which includes CFW stain, that is chalcofluor white stain, in which we will observe the broad aseptable obtuse angle branching hyphae. By obtuse angle we means the angle that is greater than 90 degree. The third methods include the culture. Mostly for fungal growth we use SDA, seborrheic dextrose anchor medium in which we will observe both vegetative and aerial growth. You will see cotton candy-like growths on culture media. Because of their aerial growth that is above the surface of the medium, it is known to be late lifter, so we can distinguish this fungus from other by having such speciality. You will see initially that they are whitish in color, while later on you will see that they become grayish in color. You should note that Rhizophus initially shows white color growth with black dots, which you can also say that it's a salt and pepper like appearance. Just look at this picture. You can see the salt and pepper like appearance on this culture media. Culture microscopy. For culture microscopy, we use LPCB stain, that is lactophenol cotton blue. The following characteristics are observed, including broad aseptate obtuse angle branching hyphae, sporangiophore ends with sporangium containing sporangiospores, and rhizoids. In the first image, you can see the species of mucormycetes that causes mucormycosis. Those three can be differentiated on the basis of presence of rhizoids. Rhizoids are thread-like structure that fungus use to anchor themselves to surface and absorb nutrients. They look like roots but are not roots. Just look at this picture. You can see the first one is mucor, the second one is rhizophus, and the third one is Apsidia. Those three species can be differentiated on the basis of the presence of the rhizophus and the number of rhizoids. Okay, the second picture showing the LPCB stain of rhizophus. Other diagnostic methods include molecular techniques like PCR to detect the specific gene, and imaging technique like CT scan and MRI to detect the extent of the spread of this disease. Here comes the prevention. It's difficult to avoid breathing in fungal spores because the fungi that causes mucormycosis are commonly present in the environment. There is no vaccine to prevent mucormycosis. Try to avoid areas with a lot of dust like construction or excavation sites. If you can't avoid these areas, wear an N95 respirator. Avoid direct contact with water damaged buildings and flood water after hurricanes and natural disaster. Wear gloves when handling materials such as soil, moss, or manure. Clean skin injuries well with soap and water, especially if they have been exposed to soil or dust. Here come the antifungal medication. If you are at high risk for developing mucormycosis, for example, if you have had an organ transplant or stem cell transplant, means you are now immunocompromised because of using immune suppressant drugs or receiving several other steroids, corticosteroids, etc. So your healthcare provider may prescribe medication to prevent mucormycosis and other mold infections. Mucormycosis is a serious infection and needs to be treated with prescription antifungal medicines. Usually amphotericin B, posaconazole or isavuconazole are prescribed for this type of infection. These medicines are given through a vein or by mouth. Often mucormycosis requires surgery to cut away the infected tissues, and this is the best way to get off from this type of infection. Furtherly, like to avoid it from disseminated into the several parts of the body. Thank you so much for listening and giving your precious time. Allah Hafiz.